Heart failure is a very serious health issue in this country right now. That's when the heart can't pump enough blood to meet the body's needs. About 5 million Americans have heart failure. 670,000 cases are diagnosed each year. But there is a new tool that's let patients send data to their healthcare providers without ever having to leave home. Dr. Robert Scott with Baylor Scott & White is here to tell us more about CardioMEMS. This word might seem foreign to a lot of people, so I kind of want to talk about this is new, especially for your guys' practice, correct?
It is. It's a recently FDA-approved device for the treatment of patients with heart failure, and it's really quite novel. It's the only one out.
Yeah.
It allows us to remotely monitor the pressures in the heart that are the earliest indication that someone's going to have worsening heart failure before they end up in the hospital.
Wow.
Most of the times we just tell patients to look for symptoms such as swelling to alert us, but that only works about 4 or 5 days prior to admission. Other causes are, weight gain, but again, that's only about a week.
Right.
These pressures start to go up in the heart about 2 weeks before an impending crisis.
Okay.
And we're able to intervene sooner on that.
So is this something that gets implanted? Walk me through the process of how this actually works.
Sure. Actually, as one of my patients says, does this involve slicing and dicing? No open surgery or anything. It's a standard outpatient procedure.
Okay.
Mild sedative relaxer such as Valium-like medicine. Patient comes in. We insert an IV in one of the veins in the thigh leg, and we insert a catheter, a thin plastic tube that goes up into the heart. People don't feel that. We don't have nerves inside our body. We measure pressures in the heart, and then after we measure the pressures in the heart like we routinely do, we leave this tiny little monitor device behind in the artery.
Wow.
Patient goes home and monitors.
It's pretty amazing stuff.
It is.
How, from your perspective, seeing the technology, the new stuff that has come out, how much it has helped doctors specifically look at issues like this or other diseases?
It is just impressive, the technology, because this is really kind of a cardiologist's dream. This is the only way we have to monitor a patient with heart failure and to better treat them. And it was limited to being in the hospital.
Right.
You'd have this heart catheterization done, we'd put the tube in the heart, remove it, and that's all the information we have. Now you're walking around with it.
Right.
And we're able to do it remotely. You can go across the country, doesn't matter where you go. We get these pressure readings, and then we can contact you.
And hopefully saving some lives, because I know this really affects a lot of people you were talking about.
It does. Heart failure is a very serious illness. For all forms of heart failure, there's about a 50% mortality. 50% of people will die within 5 years.
Wow.
For the more serious forms, it's about 50% within 2 years.
So hopefully this will do some help.
Yes.
Doctor, I really appreciate you taking the time to talk with us this morning.